I'm going to talk about temperature concerns with the body. Normal body temperature is 98.6 degrees Fahrenheit, which is equivalent to 37 degrees Celsius. Body temperature is regulated by the hypothalamus, the integumentary system, which includes the skin, very important in temperature regulation, the endocrine system, and think if there's anything else that regulates or has a hand in body temperature. The body can lose heat several different ways. So I don't have it written here, but I'm going to mention briefly different ways that the body can lose heat. Respiration, so heat is lost as warm air is exhaled. Radiation, heat is lost to the atmosphere or nearby objects without physically touching them. Evaporation is perspiration, like wet skin. Conduction is heat loss to nearby objects through touch. Convection is heat loss to surrounding air because warmer air rises. So water chill is an example of conduction. Chilling caused by the conduction of heat from the body when it or clothing is wet. And wind chill is part of convection. So chilling caused by a convection of heat from the body in the presence of air currents. When the body loses heat, there's a few things it does in response. It shuts down heat loss mechanisms. For example, perspiration. So sweat, your body sweats to release heat. When you're losing heat and your body wants to conserve it, it's going to shut down this mechanism of perspiration. It also attempts to increase heat production by shivering, for example. And it reduces circulation to the skin. This is because it's going to redirect the circulation to more vital parts of the body, more vital organs. So it takes the heat and redirects it from the skin, the circulation from the skin, and to the core of the body, to the vital organs. Also, the body reacts by increasing metabolism. So the amount of food that is burned as fuel. Metabolism is all of the chemical reactions that occurs in the body. Frostnip, which is an early/superficial stage, you may notice reddened skin or blanched skin. Blanched skin is whitened. And the patient may have numbness or tingling. Now, if this happens to an extremity, you can splint and cover the extremity. Frostbite, which is late/deep, is characterized by white, waxy skin that is mottled or blotchy, also known as blotchy. The skin may be gray or bluish. And the patient may have swelling and blistering. A very late sign is when the surface is frozen, but the underlying layer is still resistant. It still has a bounce to it. You don't want to administer high concentration oxygen, and don't allow the patient to drink or smoke anything, even if they feel like it's going to make them warm up or feel better. So the surface is frozen and the underlying tissue is not, it's still resistant. That's a late sign. And hypothermia, generalized cooling that reduces body temperature below normal. There's different levels, and it depends on the temperature. For example, at about 90 to 86 degrees Fahrenheit, there's less shivering but muscular rigidity and jerks. Hypothermia can cause altered mental status, one of the first signs. It can also cause irrational, sort of a stuporous state. It slows down vital signs, so slows the pulse rate, slows the respiratory rate. And also, they may have a glassy stare. A patient with hypothermia may have a glassy stare. There's some things you can, and also loss of consciousness. So when you're assessing this, you want to place the back of your hand on the patient's abdomen. This is so you can assess the skin temperature and also the skin condition. So the back of your hand on the patient's abdomen to assess. You want to be mindful with the patient that has hypothermia that you do not rewarm the limbs. Again, this can lead to vasodilation and shock. Also, do not allow the patient to move around a lot. This is because you don't want to circulate that cold blood and cause a further drop in temperature. Passive rewarmings, taking steps to prevent further heat loss and help the body rewarm itself. For example, removing wet clothing. So if a patient's wearing wet clothes, you remove the wet clothes. This is passive rewarming. Or covering the patient with a blanket. So you prevent them from losing more heat by covering them with the blanket. Central rewarming is the application of heat to the lateral chest, neck, armpits, and groin. Again, it's important to note, do not rewarm the limbs and do not allow the patient to move around. Active rewarming is the application of an external heat source to rewarm the body. This is very dangerous, and it must be in your protocol to do so, and the circumstances have to be extreme to do this. So active rewarming is dangerous because the warming will circulate the peripheral stagnated cold blood and rapidly cool the vital areas of the body, the central areas of the body, which could lead to cardiac arrest. You gotta remove restrictions first, so like an ankle bracelet or a bracelet or anything that would be restricted from swelling. You want to apply the heat source slowly. So for example, if this is done to the leg, you want to immerse it slowly without touching the sides. Do not massage the extremities. This you don't want to add to the circulating of cold blood anymore than already is going to happen. And even though it's uncomfortable for the patient, pain is a good indicator in this case. I'm going to go now to heat. Heat exhaustion. A patient will have or may have pale, moist, cool skin, profuse sweating. The patient may have heat cramps in his legs or abs. This is the case. You want to apply moist towels over the cramped muscles. And you want to administer high concentration oxygen. You could put the patient in supine position with the legs elevated as well, if that would help. Heat stroke. The patient may have hot, dry skin, or moist skin, which could be a little confusing. This is because the body is not releasing heat properly. Patient may have a full rapid pulse and little to no perspiration. They also will not have cramps. A necessary component, mandatory component for it to be considered heat stroke is altered mental status. So without the altered mental status, it's not heat stroke. And 15 liters of oxygen via non-rebreather, cold packs to the groin, neck, and armpit help. Hyperthermia, increase in body temperature above the normal. You got to pay special attention to the patient's skin color and condition. I'm going to make two little quick mentions. It's important to note that fever, or a fever from fast rising temperature, is the most common cause of pediatric seizures, called febrile seizures. So the most common cause of pediatric seizures is the febrile seizures, fever from a fast rising temperature. Also, it's important to note that you are not dead until you are warm and dead. This is because when somebody has extreme hypothermia or is very cold, their biological processes slow down, but that doesn't necessarily mean they cease or they can't start up again. So the saying is, you are not dead until you are warm and dead. Make sure. And that concludes this video on temperature concerns.